we will make a start. So a very big welcome to you from wherever you are joining our breakout group. We're delighted to have you join us in our discussion about system change, the system change that Better Starters sought to bring about. So today, the session we're going to be led by myself, and I'm the director of A Better Start in Southend, Nia Thomas, and I'm going to be supported by my colleague Tara Poor, who is the Chief Executive and co-founder of City Family Community Interest Company, and supported by colleagues from Blackpool, Bradford, Lambeth and Nottingham. So what are we going to be talking about this afternoon? In this group, we're going to explore what system change means for A Better Start and what our enablers for success have been. We'll also share a case study with you about what we've been doing in Southend to instigate that longer term system change that we really want to see. And then our colleagues from the other Better Start sites are going to be sharing with you some of their experiences and learning. And at the end, we'll have an opportunity to have a question and answer session. So please make sure that you take notes of any questions that you'd like to ask or pop them in the chat as we go through. And the fabulous Ava from the National Children's Bureau is going to be helping us gather all of those questions together at the end. So bringing about system change is one of the objectives of A Better Start, alongside, as you've just heard, the social and emotional, diet and nutrition and communication and language outcomes. In Southend, we've also got the community resilience objective and that change that we want to see. So what does bringing about system change mean? Well, to change for the better the way that local health, public services and the voluntary and community sector work together with parents to improve outcomes for children. That's what we mean when we talk about system change. And over the last nearly 10 years of delivery, we've discovered that for us, the enablers for system change are these 10 things. So number one, equality and inclusion. We always aim to include all voices in what we do and to be proactive in giving our stakeholders those voices. So co-production with our parents has been really important in shaping not only what is delivered, but how it's delivered. And you'll hear from Nottingham shortly about how local parents influence their infant feeding campaign. Commitment. The commitment of partners is essential to instilling that system change, and that commitment has to be both strategic and organisation-wide to make sure that we don't lose that commitment when people move on to different roles. I'm sure we've all had experience of people moving on into different roles. And we need to make sure that our processes, our strategies, our organisational DNA retains that commitment regardless of who's within the organisation or who's moved on. Shared vision. In achieving that commitment, there's got to be a shared vision, and that's got to be stated clearly, revisited often, and universally understood, and that's across practitioners, parents, and other professionals. Partnership working is more than just a commitment to that shared vision. It's that practical application of the vision and each partner playing their part to achieve that change. It's not just about talking the talk inside the partnership board meeting, it's also about walking the walk outside of that boardroom. And in Southend, we've got a number of strategic partners that are signatories to our collective success. So we generally think of the local council, the NHS trusts, the Integrated Care Board, the Voluntary Sector Alliance, and they are all signed up strategic partners to our success. Trust. Partnership working has to be underpinned by trust between organisations as well as between individuals, and that trust doesn't happen overnight and it doesn't just happen by chance. All partners have to be vulnerable in sharing what they don't know, and they've really got to put their egos aside in order to put the needs of children at the very centre of the way that we think and the way we operate. And I often say that I really don't mind whose logo goes first, as long as children and families get the support that they need when they need it. Number 6. System change means that we don't consider our services in isolation from the other services that parents might be accessing or the services that children might be transitioning into and out of. So a Southend example is that we have our one-to-one breastfeeding support on our labour ward, which directly connects to the group breastfeeding support in the community. And then that is supported by the wider business-focused and organisation-focused scheme, which is called Southend Supports Breastfeeding, which aims to normalise breastfeeding and support breastfeeding in the community. You'll shortly hear from Blackpool, and they'll tell you a little bit about their system-wide approach in making a difference to children born into care. Innovative approaches. We're a 10-year test and learn programme, which means that we're designed to test innovative approaches. The lotteries really look to us to innovate in that early years space so that we can learn for our local communities and we can benefit others nationally and UK-wide, as we've seen in today's conference. You'll hear from Lambeth, who will talk about their maternity disadvantage assessment tool. And even though it may have been developed in Lambeth, it has that opportunity to support people well outside of the Lambeth boundaries. Research, evaluation and impact. We are relentless in monitoring and evaluating and evidencing the impact of our innovative approaches, because we value both the ability to understand our impact and share that with others. And we also know that to make the case for future funding, evidence of impact is critical. In Southend, we've got local performance and research team within the ABSS team. We are supported by our local council. We have external evaluation led by the University of Essex, and we work with external research consultants. We also feed into the National Evaluation Programme that you just heard about, that overlays on top of all of that. In Bradford's case study shortly, you'll hear about how research and evaluation forms part of their service design approach. We're responsive and adaptive, and as a test and learn programme, we've been set up to be responsive and adaptive. And over the 10 years, we've seen projects established and projects close, and we're not frightened to stand by those convictions and to disinvest in less effective projects to reinvest in those more effective ones. And number 10, a skilled and supported workforce. Our services rest on the effectiveness of our passionate and committed workforce. So we need to ensure we provide them with the most up-to-date and relevant training. And where we can, we future-proof our organisations by taking a train-the-trainer approach so that we can retain that knowledge within the organisation and we can disseminate it and ensure that there's succession planning. And we're always considering that as part of our workforce development. And only when you've got all of these in place do you start to see the behaviour of the system changing and the flow of children and families through that system happening more effectively and more efficiently. Families really shouldn't be burdened with which organisation is delivering the services to them, because they should be focused on receiving services that are well equipped, that they're joined up and they're responsive to meet their needs at the right place at the right time. So our case study, let me start by telling you a little bit about Southend. So we're on the southeast corner of England, just north of the Thames, and our city runs along the coastline of the Thames estuary. We're about 45 miles east of Big Ben. We have high levels of deprivation in our city, alongside pockets of quite high affluence. Our families have poorer access to maternity care within the first 10 weeks of pregnancy. We have higher smoking rates and higher rates of obesity. The average number of births in the A Better Start wards is now around 800 a year, and that's been steadily decreasing during the lifespan of A Better Start from around 1,000. And our population in the city is now becoming older, and frailty is a priority area for our local council and NHS services. So that gives you an idea of how things are shifting and changing in our city. So I'm going to hand over to Tara Paul, who I said is the co-founder and CEO of City Family Community Interest Company, which is the social enterprise that was founded in 2022 as the legacy vehicle of A Better Start Southend. So Tara, on to you.
Thanks, Nia. So 10 years feels like a long time, but when you're developing, delivering and evaluating whole system change, the time does go by quite fast. Members of the A Better Start Southend partnership agreed that 2025 should mark the start of the next 10 years of innovation, responsive and valued services for our youngest residents and their families. City Family was formed by practitioners and parents of the ABSS partnership with a shared and unwavering commitment to take forward and seek routes to sustainment of the most impactful elements of the partnership and the programme. In 2023, City Family Community Interest Company became a formal deliverer of A Better Start services, with key programmes and staff transferring across over a 6-month period. We deliver 4 key programmes on behalf of A Better Start. They are all focused on improving outcomes for children and their families by removing barriers to access, increasing community cohesion and empowering parents to be the very best parents they can be. City Family Explorers is our family hub and community creche. Your Family is our strengths-based family engagement and support offer. Talking Transitions is our whole year group school readiness programme that works with speech and language therapists, early year settings and feeder schools and parents. And Dads Connect is our tailored peer support programme which really looks at aiming and engaging with dads, male carers, to improve their access to services and their visibility. So very, very key for some of the discussion points that we've had today. We are working to sustain these programmes locally, whilst also tenaciously following routes to take the learning and expand to new geographical footprints in communities. Part of the beauty of setting up a City Family was that we didn't have some of those geographical and age range restrictions. So we can really take those impactful elements and take them to other areas and to meet additional needs and unmet needs in other areas and age ranges. So whilst delivering service on behalf of A Better Start really is our main focus, we are also ensuring that from board level to frontline delivery, we are speaking with a genuine diversity of lived and professional experience. City Family Board has strategic oversight, and it's been our mission from the start to ensure that local parent experience informs and guides our approaches. I'm very pleased to say that we have 3 local early years parents on our board who work alongside health practitioners, policy experts and other system leaders. And I'm going to introduce you to them in a moment, 2 of them anyway, via video. So it's Emma and Sarah. What's really unique about Emma and Sarah's role in this is they were ABSS parent champions and have brought that experience and that positivity that they gained from being parent champions in Southend and having actually such a really crucial role in the community. So without further ado, I'm going to ask for the video to be played and you'll hear from Emma and Sarah.
Hi, I'm Tara Poor. I'm co-founder and Chief Executive Officer of City Family CIC. City Family was founded to take forward the key parts of the A Better Start Southend programme, a 10-year national lottery-funded strategic programme that seeks to improve the outcomes for children living in the more deprived areas of Southend. When founding City Family, it was clear that community leadership had to continue through our organisation. We looked at a number of ways that we could do this, and we decided that through our infrastructure and our governance, we would have parents there supporting what we do, guiding what we do, and supporting in the design of those services.
So I'm Anthony Quinn, I'm the Chief Executive Officer at Southend Association of Voluntary Services. Parent Champion is a unique volunteer role. It's an opportunity for parents to come in and share their experience and their life learnings and what it's like to live where they live. What we've seen is that a couple of the Parent Champions have felt that they wanted to embrace the offer and approach the recruitment process to become part of the City Family.
I'm Sarah Miller. I was A Better Start Southend Parent Champion, and now I am a City Family Non-Executive Director. One of the best things of being a Parent Champion is you're so informed of everything, all the services available in the wider community, that you can help other parents and other families. I thought it was so important that I applied to be a Non-Executive Director, and here I am.
I'm Emma. I was a parent champion for ABSS, and I am now a non-executive director for City Family. I think my knowledge of the area and the services available grew so much through being a parent champion. I suppose I got to feel useful again in other ways than just being a mum.
We wanted to ensure that ABSS parent champions had the opportunity to apply for these roles so they could bring their lived experience to the governing body of City Family, working alongside health practitioners, care practitioners, members of the business community in shaping the strategic direction of our organisation. We worked with SAVs to provide guidance, information and support to parent champions that had expressed an interest. And we were really keen then to see those applications come through for the non-executive director roles for the board.
The opportunity came up and I felt like that was a good fit for me. Being able to be in that space with quite important people in the area and feel that you're heard and be able to give your voice. I mean, I interviewed for it, so they know me and they know what I can bring, and it's nice to know that they know that I can bring things.
I first signed up to Community Investment Board and then gained some experience in there, in the wider community, and a lot in funding and CICs. And then from there, I applied to be a City Family non-executive director.
Sarah and Emma's passion for their community was evident through their application and their interview process. We were astounded by what they wanted to bring, and what was absolutely abundantly clear was that they had learned and brought so much from their parent champion role into their application, and that they were absolutely adamant that for them this was the next step in their journey.
Parent champion training and activities definitely improved my confidence for the role, but it was a combination of my professional experience, my parent champion experience, but also all the people from all of those avenues gave me the confidence. I got such a network of good people that I just don't want to lose them.
The role local early years parents have had in shaping A Better Start programme has been phenomenal. Practitioners, system leaders and local organisations have worked alongside parents from the community to shape, design and deliver services. They've governed, they've been there to support, advise and ensure that what is being delivered on the ground is recognisable to the people that are utilising those services.
It was just great to just be able to be heard by people that can actually make change. The A Better Start programme was so good. I wanted it to be a success. It needs to live on, and through City Family, that's its way of sustaining the legacy and service for the community.
It's even more exciting because I'm there from the beginning. I'm really looking forward to getting more involved with it as well.
It's very exciting. I'm really looking forward to what's to come. I'm just really, really pleased to be a part of it and to be able to have some input into what it delivers and what the future holds. Our main goal is supporting families, supporting children and giving them the best chance in life. And I just want that for other families like I had with mine.
Sarah and Emma hold roles on our board, and we are really truly grateful for the experience that they bring, how they hold us to account as the remainder of the board to shape and design those services that we will be delivering for families in the future. We truly believe that overcoming systematic local challenge lies within the communities themselves. We need to ensure that system leaders, policymakers are hearing from and listening to community members, really harnessing the power of what is around them every day.
It's brilliant, such a brilliant video, thank you. So let's move on to hear some case studies from elsewhere in A Better Start around England, and I'm going to head to Blackpool first.
Thank you very much. So, hi everyone, I'm Adrian Mackay. I'm a Development Support Officer with Blackpool Better Start, and I want to speak to you today around one aspect of our Born into Care work that is ongoing. So back in 2020, Blackpool became a partner in the National Born into Care study, developing the best practice guidelines for when the state intervenes at birth. In response to these guidelines, and really recognising the value of place-based and experience-based knowledge and wanting to change the system for families, Blackpool committed to co-producing their response by working together with professionals across the Blackpool Better Start partnership and parents with lived experience. The foundation of using co-production was the appreciation that those with lived experience of their local area, their health and their needs are best placed to advise on services that can make a positive difference to their lives. And an understanding that there are significant benefits for both the individuals involved in co-production and the system it transforms. At the start of this co-production process, it was really important to develop a shared vision of priority areas for change. There were two initial co-production groups were formed, a mothers and a fathers group, which included senior leaders from children's social care, midwifery, academics, members of Blackpool Council and the co-production team, and also parents with lived experience. The group started with members really getting to know each other over quite a long period of time. So whether that was spending time doing craft activities, having a walk on the prom, or at one point going to a local boxing gym, it was really about getting to know each other as people rather than job titles. And that was essential to establish trust in the group, developing not only a safe, but a really brave space to have often honest and very challenging conversations. The group worked together over a period of about 10 weeks to create a set of 8 principles for any service or offer working with families at risk of separation. There was a film made about this process and the link has just gone into the chat there. So one of the principles that came out of this was that parents need to be helped to understand the children's social care process and be kept informed at every step of the way. Parents consistently told us in these co-production groups that they don't understand the system and they really don't understand where they are in it often. So steering group, again, made up of professionals and parents, directed the work, and there was a co-production group ran at the beginning of 2023, which aimed to map each step of the children's social care system that would help families understand the process and navigate through the care system, and that would all be held into one document, and essentially using language that parents could understand. The next step of this was to translate what was at the time a huge Microsoft Word document into a physical tool that can be used by a wide range of professionals in dialogue with parents. So in October 2023, a co-design group headed by Leon Cruikshank, a designer from Lancaster University, ran to collaboratively create this resource. The weekly sessions were spent establishing relationships, examining evaluation measures for the output, generating ideas and creating prototypes. Then the hard bit, critically examining these, and then finally testing out with the wider system. There were several resources developed, including the map that you can see on the slide here. There was a one-page document, a full beans document, and also a glossary that were created. And the link for these will go into the chat as well. And we do have plans to create some videos further into the year. So really, to summarise all this, the key to all of this work really was partnership, and it's been really important to test out with a wide range of professional services and parents. So we've tested out with a team in our strengthening supporting families and 2 targeted services here in Blackpool for Baby Sick and the Early Parenthood Service. And it's been really important to keep these resources as live documents so that changes can be made in response to feedback from the workers and parents. Thank you very much, and I will pass on to Sarah.
Thanks, Adrian. My name's Sarah Ahern. I'm the Programme Manager of the Better Start Bradford Innovation Hub. So we're the research and evaluation partner of Better Start Bradford. As I think most of us know, when we set out on our A Better Start journey nearly a decade ago, the evidence base for early life interventions was pretty patchy, to say the least. And this made it really difficult for commissioners to identify where best to invest money to ensure that families were receiving the support they needed to provide children with the best start to life. So it was our ambition in Bradford to embed evaluation right from the start into the design and implementation of every project within the Better Start Bradford offer. To do this, we worked in partnership with our project delivery organisations, key system partners and the community to develop an approach to service design that supports good quality monitoring and evaluation to optimise learning, to help develop the evidence base, but also to ensure that we were meeting the community and stakeholder needs. At its foundation, our approach has theories of change and logic models, which allow us to map out the mechanisms of change which sit behind projects, so we know how they're going to create impact, and to develop a blueprint for delivery. And not only does this support implementation, but it has allowed us to work with deliverers to ensure that they're capturing the data needed to evidence success. A big part of this has also been around shifting thinking within the system around what makes a good evaluation and how we understand what works, with a focus on establishing good quality monitoring and implementation evaluations to understand what's happening on the ground before exploring outcomes, and moving through levels of evaluation as shown across the arrow on this slide. So again, that's supported by this theory of change and logic model tools. Having a co-produced and consistent approach to evaluation over the lifetime of Better Start Bradford's has allowed us to demonstrate the value of nudging up evidence, and that understanding what is delivered and to who is vital for understanding impact on outcomes. Our work with partners has meant that this approach is starting to be taken on more broadly across the system. And in the last few years, the Reducing Inequalities in Communities programme has used the approach, broadening its use beyond early life interventions to the whole life course and allowing them to show real impact of their interventions. Bradford's also part of the government's Family Hub Start for Life programme, and we've been working with the team to look at how they can adopt the approach to ensure we continue to build the evidence base for early intervention with families and young children in our district, but also looking at how we support sustainability. We're also increasingly seeing our local authority and health partners use our approach in their commissioning and planning, which we see as an incredibly important step in supporting decision making, particularly in an increasingly difficult financial context. In terms of next steps, we're currently in the process of reviewing and updating our toolkits, and I think there's a link to these in the chat, so that they allow commissioners and practitioners to take on the approach. And we're continuing to do this with input from stakeholders to ensure it remains relevant and appropriate, and to build on our legacy around evaluation that's been created by Better Start Bradford and the Innovation Hub. Thank you, and I'm going to pass on to Sophie in Lambeth.
Brilliant. Thank you so much. And good afternoon, everybody. My name's Sophie Woodhead, and I'm the Assistant Director of the Lambeth Early Action Partnership. And I'm going to be presenting a little case study about the Maternity Disadvantage Assessment Tool, which was presented and launched at the Royal College of Midwives Conference last month, which you can see on the slide there. The tool was developed in 2018-19 as a bespoke holistic tool for midwives to be able to measure vulnerability in pregnancy and during the early postnatal period. Across the UK, the risk of maternal death is 3.8 times higher for women from Black ethnic backgrounds and 1.8 times higher for women from Asian backgrounds compared with white women. Maternal mortality rates are also highest for women living in most deprived areas. 43% of the neighbourhoods where LEAP works are classified as most deprived, and because of the markedly higher rates, the higher maternal mortality risk for women living in the areas of Lambeth where LEAP works, LEAP wanted to develop a better system to improve maternal and infant outcomes. The LEAP Health team approached the development of MATDAT in response to concerns by midwives that the health team midwives that, unlike GPs and health visitors, midwives did not have an existing system for assessing and recording vulnerability in pregnancy and the early stages of parenting. LEAP found that having no formal frameworks to assess maternal vulnerability meant that midwives may not be able to consistently identify levels of vulnerability, lack clear referral pathways for care planning. There was a dependency to rely on tacit knowledge, which we describe as gut instincts or proxy measures to measure vulnerability in their population. It also meant that there was no shared language to discuss vulnerable women with other disciplines, leading to poor interprofessional communication around assessment and referral. So for pregnant people, children, their families, having no formal framework to assess maternal vulnerability means that they may be less likely to receive timely and appropriate preventative support. MATDAT was developed in consultation with safeguarding mental health leads in Lambeth, as well as service users and 2 local NHS trusts. And it consists of 2 main components. The first part acts as a threshold document to be able to support referrals for additional support, assessing 3 main categories: family and the pregnant person's developmental needs, environmental factors, and parental and family factors. Women are then categorised as level 1, 2, 3, or 4, coloured green, yellow, amber, and red, respectively. And the second part of the document, a really important part, is a care planning guide listing possible sources of support for that individual at each level. An accompanying reference sheet has contact details for local support services that can be developed by individual maternity services about their own local resources. In the piloting of this tool, we conducted an evaluation, and the evaluation found that MATDAT really has value as an internal threshold document for referral to multidisciplinary team meetings and specialist pathways, as well as being able to be used for communication with external agencies. It supported midwives to check their intuitive response and to facilitate joint decision making. Also supports midwives to escalate concerning cases back to the local authority. So really, it's the tool has a lot of potential based on the findings from this evaluation to be valuable in quantifying the demands of team caseloads and to ensure even distribution of caseloads. We're really confident that MATDAC will continue to support midwives to deliver more individual-centred and responsive care. The scale of complexities that we're now facing means we must work in partnership with other health and social care professionals and national organisations. And MATDAT provides the opportunity to link midwives with appropriate services and external agencies for additional support when needed. We're delighted that the MATDAT tool developed by LEAP is now available nationally from the Royal College of Midwives. And as I mentioned, that was launched just last month, and the tool is available online, and I think it's been posted in the chat. And we know that MATDAT also really supports the national ambitions for more personalised and client-centred midwifery care. Thank you so much, and I'll pass on to Donna now for the Experience of Nottingham.
Thanks so much, Sophie. So hi everybody, my name's Donna Sherratt. I'm the Head of Programmes at Small Steps Big Changes, and I'm going to talk about what Nottingham have done to change the system from a campaigns perspective. And it was great to hear Elliot talk about the campaign that he's recently launched as well, about shouting about dads and the impact that had. And that's very much what we'd seen from our approach. So, as I say, I'm going to focus on the practice, policy and people changes that we saw from a campaign. So SSBC set out to change the social norms of breastfeeding, recognising that it's beneficial to the parent, baby, employers, wider community, and obviously babies themselves receiving that initial milk and also sustained feeding as well. In response to this, we came up with the campaign, which was crafted, the name itself was Feed Your Way. And that in itself helps you to understand the campaign and the impact that it has. So it was it's a public health breastfeeding campaign, and it was co-produced, which is really significant, and launched in October 2022. So how did it change the system? Well, even in its creation, that's where the change started really. So the shared knowledge and expertise of data and information from a wide range of stakeholders, and as Nia mentioned earlier, from a co-production point of view, parents were at the heart of that. So their voice and their experience was equally valued alongside all of the data that we know about breastfeeding and the benefits of that as well. Solutions were co-produced, which in itself had that ripple effect and made sure that it was the right type of change to make a difference. And in all of those interactions, that built a wide range of interest across different stakeholders. So the change came in creating the research and also the development of the project as well. So there's a wide range of desktop research, as I've already said, with data. The research was inclusive in terms of having midwives, public health specialists, peer supporters, parents, wider family members, whether that was grandparents, co-parents, coming together to talk about their knowledge and experience of that feeding agenda. We had a survey that we had 1,800 respondents to, and it was acknowledged as we had those responses. We asked that crucial question of who haven't we heard from, and one of those groups was fathers. So then we went out and got some more depth information from them as well, and used different focus groups as well as surveys. So what we heard from all of that interaction and all of that research was that most people knew the benefits, and it wasn't necessarily of being convinced what the benefits were. It was more the way that the message was delivered, which is where the behaviour change methodologies came into it. So the messages tended to be delivered from a health perspective or a risk adverse perspective. And, I'm sure we can all think of examples where we've heard that message come along. So it was recognised that this was a civic issue and actually required a overarching whole holistic approach. And as part of that, we developed the campaign around resources for the workforce, for families themselves, and this created opportunity to create some case studies, because we wanted to make sure that Feed Your Way meant all sorts of family makeup, all sorts of situations. So we had 5 case studies developed, and you'll be able to look at the website through the chat, and I do recommend that you click on that link to have a look at the broad range of resources that are available. We had posters and videos, and locally there was a real campaign. It was very visible, a bit like Elliot described with his campaign as well, that we had bus stops with the campaign posters. There were banners on the council house. So what people had experienced in crafting the Feed Your Way campaign, they also experienced when they were out and about in the community. So the impact that this had locally was there was a whole range of people who were already aware of the campaign and knew the detail behind it, and were able to share that in lots of different ways. And they were really specific about crafting what type of case studies we had, what type of families were in that, and what the logo looked like. And as I say, Feed Your Way enabled it to be a non-stigmatizing approach. And that is what we heard from our practitioners as well. So from a terminology perspective, a lot of the people going out and having conversations which were sometimes felt to be quite difficult about feeding options, the fact that the title was Feed Your Way helped it break down some of those challenges. Also, we were able to link in with the father inclusive practice work that you would have heard Carla speak about earlier on, in that bringing fathers into the room and wider support networks from that breastfeeding perspective. Furthermore, with our local commissioners, they have built into Eating and Moving for Good Health strategy that Feed Your Way is part of that. And we're also close to agreeing that Public Health will host Feed Your Way moving forward. Then nationally, we've had Feed Your Way hosted in lots of different spaces. So all of the knowledge that's been crafted in that very intense way of building the campaign, and therefore the materials, have been shared at the Institute for Health Visiting in a conference in September. One of the key areas that it was debated and has helped to have an impact in government and parliament was with the infant feeding and inequalities all-party political group. So we had a member of staff, Jill Smith, who went and presented, and that created a whole depth of conversation, and people who've been involved and had historic experience of how they've delivered breastfeeding or infant feeding messages previously had a different perspective after we were able to present there. And then once again tomorrow we're at the World Public Health Nutrition Convention. So it just gives that overview of the different levels of change that can happen from a campaign in its creation, its delivery, and that continual dissemination as well. So I'll hand back to Nia.
Brilliant. Thank you very much to all Better Start colleagues for sharing their experiences and learning about system change. I know I may have heard it 3 times, but it is very interesting, and there is so much to learn. And every time I've heard colleagues speak, I've heard something different. So thank you. So some thoughts before we head into questions. Whether we are considering system change at a local system or national level, we really must start with this commitment to an understanding of prevention and early intervention. You have to have the partners that are willing to put in time, effort and funding into supporting the very youngest members of our community and their families. Those partners must work collaboratively with a shared vision, developing trusting relationships, and are proactive in co-producing services with community engagement. We value research and evaluation to evidence our impact, and we learn from it, and we respond and we adapt with innovative approaches developed by a skilled and supported workforce. So what next? In March 2025, A Better Start funding ends, and we know that the public sector, which is the greatest source of potential ongoing funding, is highly constrained, and many integrated care boards have quite ambitious saving targets for the next few years. And of course, we're in an uncertain political landscape. This is all against the backdrop of increasing demand. The impact of COVID is still emerging, and the cost of living crisis is squeezing both parents and providers. So our call to action to you and to your organisations is to continue to pursue system change by using co-production techniques to include the voices of parents and families to ensure that services are designed alongside them. Ensure that there's a partnership commitment to both recognise the complexity of current systems and that commitment to really simplify those systems and to sweat the assets, using the assets that are already available to us. We need to continue monitoring for evidence of impact, because in a constrained financial climate, we know that we need that evidence to justify future funding. And the most important thing, let's always put children at the heart of our decision making. If we can agree on putting children at the centre, we can collaborate, debate and work in partnership to figure out the rest. So thank you. Questions and answers. Ava, do we have any questions in the chat?
We do. We've got a question on the impact of breastfeeding rates after the Feed Your Way campaign was introduced.
Thanks very much. So what we've recognised is that it's quite difficult, bearing in mind the breastfeeding, the campaign launched in October, to pinpoint on some of those specific areas, and it just been the campaign, partly because there's been so many different things happening across the Better Start site area. So we've got our family mentors, which Carla mentioned earlier, and they use the campaign to support some of the conversations. So that in itself has had an impact. We've also introduced peer breastfeeders as part of our 0 to 19 service. So whilst we have seen a slight increase in the feeding rates, we're, as with many of these things, really difficult to pinpoint on, was it just the campaign? What we have recognised from the campaign is the great interest that we've had locally, nationally, and also which you don't always get with some of these campaigns or services, where we're actively asked all of the time about that practitioners themselves, whether it's come from senior managers or individuals, have heard about the campaign, the impact that it's had and how it's enabled easier conversations and helped to make change. So a lot of the workforce have found that it's eased into a conversation that might have been difficult, or parents might have just shut down to think, you're just trying to force me to breastfeed. There's more of a conversation of choice.
Brilliant, thank you, Donna. Anything else, Ava?
Yeah, we've got one more question. Are the non-executive directors paid roles, and is there a minimum term, or can they stay as long as they want?
Tara. Is Tara there? There.
Sorry, everything was frozen. Yes, they are. They claim a stipend. So it's a very modest amount, and we've set a term of 3 years.
Wonderful, thank you. Any other questions? And if anybody wants to come off mute and ask it, you're very welcome to as well. If there aren't any questions, I'm gonna take the opportunity and ask one myself. A couple of colleagues from different areas talked about tools and packs and resources. Are you already hearing about, or what are you hearing about these resources being used elsewhere, whether in England, Ireland, Scotland, Wales and beyond? Are other countries, other regions picking up these resources and adapting them, using them? What are you hearing? Maybe Sophie, do you want to go first?
Thanks so much, Nia. And yeah, I think it's a great question. What we have done to ensure the kind of further uptake and utilization of specifically the MatDat tool is partner with a national body, the RCM, who were able to kind of further develop the tool for utilization at in various different localities. So we found that to be a really big enabler for this specific tool developed as in the context, within the context of Lambeth, and specifically the areas that LEAP work in, to then use the platform of RCM and those kind of existing networks to work collaboratively with that body to then be able to enable further access to these tools, because I think a lot of the time it's, you know, these fantastic innovations are made at the local level, and so it's finding the pathway for that information to then be scaled up. And what we're really interested to see, as the launch only took place last month, is what that uptake is going to look like, and what the needs will be for continued support with regards to any additional training. And we always know that when you develop something in a kind of at a small scale, the pathway then for it to be scaled up could mean some differences and some adaptations as well, and we're very interested to see that process.
Brilliant. Sarah, did you want to come in?
Yes, thanks, Nia. I think what we're finding is there's increasingly an appetite around tools like theories of change and logic models, but what we tend to find is there's still a lot of confusion out there about how they're used, and they tend to be used interchangeably, and that's just not how they work. They are separate tools that are related, and you need both of them really to support really good quality evaluation. So I think one of the reasons there's been a positive response to our toolkits is because we do lay that out separately. We have had appetite nationally, and there's a public health apprenticeship scheme that's approached us about our whole toolkit really in supporting public health practitioners who are coming through now and will be our public health practitioners of the future, in having that knowledge around what underpins strong evaluation, which is just really, really positive. And we have had some international interest as well. We've had an organisation in Africa approach us about some training that they're delivering around evaluation and wanting to use our toolkits and videos as part of that. So I think we've had a really positive response, but we know we can do more to sort of scale it down a little bit and make it more usable for the smaller organisations, perhaps.
That's brilliant. I wonder if I can ask another question. Maybe Adrienne, I was interested in your Born into Care, your system map and the processes and the tools that you've built with your families. What is your thinking in terms of keeping this up to date? Because I'm conscious that you've had the initial conversation with parents. It's not just a one and done, because things are going to change. How do you keep that communication going with parents?
Yeah, absolutely. We do have like a monthly working group that obviously the group meets. There's parents that are, you know, they attend that. There's also a parents advisory group that feed into that group as well. And like I said, the documents absolutely stay live. There is so if you click onto the link as well, there is a feedback form, and because we're aware that obviously things are constantly changing, the system is constantly changing, and also we need that feedback from people to say that actually are they accessible, was it useful? And we were very mindful through this entire process that it wasn't going to be something that you would print off and give to families and they would kind of go away and use that. It would be working with families and kind of in dialogue using this, and just that it would be a tool to kind of help some of those discussions. So I think very, very mindful that things can be changed and will be changed, and even some of the images on there as well, we're still really kind of open to get feedback on that and how families feel with that as well.
That's brilliant. Ava, have we had anything come in through the chat? I'm conscious we've probably got about 2.5-3 minutes left, if that.
No, nothing extra in the chat.
Wonderful. In that case, a very big thank you to all presenters today, and to everybody that's joined us and contributed to our thinking and our answers and Q&A session. Thank you very much. We will see you all back in the main room.